in nursing and its importance to quality healthcare delivery. On an introduction note, issue of leadership or being a leader. There is a wrong perception we used to have. I am not in charge of the world. Or Salamatu is not in charge of the world. As such, she or he is not a leader. No, it's categorically wrong. When Mommy was delivering her message, she said today. But if you look at some years back, she's not up to that level. So some years to come, the least person that is getting admission now into Shehu Sule will definitely one day reach to her office. So it's no matter of niba leader. This is wrong. One day you will be a leader. Said presentation. Leadership. It will contribute to us as nurses to have what we call effective communication, decision making and problem solving, accountability and professionalism, team building and motivation. Next slide. Now, introduction. Leadership in nursing is crucial. It is so important in delivering high quality healthcare. Effective nurse leaders inspire, motivate, and empower their teams to provide patient-centered care, drive innovation, and improve outcomes. Next slide. The word leadership was defined by several authors. There are so many definitions of leadership, but the purpose of this presentation, let us look at the definition of leadership by Alan Cate. Alan Cate defined leadership as about creating a way for people to contribute for something extraordinary to happen. Now, by going by this definition is that if Sister Elizabeth is the leader of the world, does not mean that she will be the person to just make decision. There is no way for student Salisu to say, ga Abu Kazada zai taimake mu. Right, next slide. Leadership is all about developing people and helping others to reach their full potentials. It is about equipping others with the right tools and strategies of an organization, but also the life of individuals. It is about breaking down barriers and leading others through the uncertainty of the future. The example I gave us the other time is, today, Mommy is the DHOD clinicals. Some years to come, retirement, don't reach. Maybe at the time, my Umar may be assigned to be the DHOD. But the issue is, if you are in that position, who did you help or guide so that when you are moving out, somebody will take the position and will play that role? At that point, I want to bring to us an adage. Success is actually a failure when you don't have a right successor. The person that succeeds you, you are now blabbing that you have achieved this, you have achieved this. But at the far, when you just move a step forward, the person that comes to your place didn't maintain the goals you have achieved. So at least at the end of the day, what you have achieved has been destroyed. So when I motivate his or her subordinate to complete assignments that will lead to the progress of the organization, leadership therefore is not just limited to just giving orders and or command. Giving orders and or command, and this is where the issue is. Most cases, being a leader, or so many people perceive it as If they said you are a team leader of team A, your role is just to say ayi kaza, kar ayi kaza. No. You should help your subordinate, coordinate them, and listen to their suggestion. That suggestion will help you, or will help the entire team to reach a success level. Next slide. The team to get the job done regardless of the method used. How will you do that? You create an enabling environment. An enabling environment is not always the leader that do the work, but the subordinates or the supporters or the followers are the one to do the work. But does the leader create the enabling environment for the supporters or subordinates to do the work? All that the followers want is just the expected result. Now, in regard to the facility we are now discussing, since we are all nurses and we are now, our central goal is looking after our patients to get well. Then the expected result here is the number of patients being discharged or managed successfully has to be improved. The irony of leadership is that sometimes when the expected result has been achieved, nobody will praise or appreciate your personal efforts. As a matter of fact, those that did nothing when the struggle is accomplished, the set targets was on, will oftentimes be the ones that will place themselves strategically to reap the benefits and accolades. It is up to the leader to praise and appreciate the team that supported him or her to achieve the success. The simplest example I'm going to give first is, let's give example with our department in this facility. When there is an improve in the nursing services we are rendering to our patients, the credit first goes to HOD nursing as in the department. But it is Nurse Ahmad that did it, or it is Nurse Balamba that did it, but the credit goes to him. But the issue is, if you now said, I shouldn't do it so that the credit will not go to him, then get ready. It is now a cycle. When you fail for somebody to have that accolade, then get ready when your time. Somebody will also contribute in your derailment. Next slide. Therefore, if the main goal of a hospital setting is to achieve high quality care, then the top managers, that institution should be more concerned about every facet of the leadership structure. And since nurses and midwives play such a significant role to achieve such standard of care, their ability to provide the lead need to be constantly updated and should be made a top priority by the management. If you look at it now, as DHOD is here sitting, in the morning, she will now go around, go to medical ward, go to A&E. How are you? What's the challenge? She's not after the patient straight. She's after the in-charges. Now, the in-charges are the one responsible for the staff. Then this is how the hierarchy is. Once the deputy HOD or the HOD did not make an enabling environment for the in-charges to work, then the in-charges will now make an enabling environment for the members of staff to work. Then at the end of the day, what we are able to get is poor turnout of patient success in the treatment. Next. This paper will be more focused, providing effective leadership in the hospital wards. We talk about leadership, then we are now specific. Now the specificity is, we have wards, we have units. Now, how can we improve the leadership style in those wards and units? Now, this paper will be more focused on nurses' leadership role in the wards and the entire hospital. Providing effective leadership in a hospital wards is crucial for ensuring high-quality patient care, promoting a positive work environment, and supporting staff development and mentoring. Next slide. Two, clear communication. This communication have several dimensions. There is a communication between the matron in charge or the person in charge with the management. Then there is a communication between the matron in charge or the person in charge with the staff. Then don't forget another one. Members of staff with the patients and patient relative. All these communications encompasses, and when they are effectively carried out, then at the end of the day, we are going to have an improved quality care. Now, let me just cite an example here. It was one nasty scenario that happens. It was one busiest day in A&E. The staff there was a patient relative whose patient was having an acute abdominal pain. The patient was reviewed by the casualty officer and the patient was placed on antacid. So unfortunate, the patient relative was busy talking to the staff and the staff was busy attending another patient. What was the discussion? The patient relative said, "Is it this drug I'm going to give the patient?" But it was so unfortunate, the patient relative is holding spirit. Yes, spirit. Now the staff was busy attending to the other patient without actually going back to see the drug. At the end of the day, it was nasty scenario. The patient relative took spirit and gave to the patient. I'm just giving us a scenario here. There are a lot. There are more. This is the communication that happens. So now look at this clear communication. If the communication was clear, that could have been prevented. Now, it is very, very important. When group of people or group of members of staff come together to discuss, all communications and policies will be shared effectively, and it will also contribute in implementing of that policy perfectly. Next slide. Setting direction. Yeah, establishing a clear vision, mission, and objectives. Making decisions. As a leader, it is your responsibility to guide your team in decision-making processes, and always have it at the back of your mind that most of your decisions can impact negatively or positively on the life of the patient in your care and the entire hospital setting. This point specifically, if the relationship between the matron in charge or the person in charge with the staff of the department will make the department friendly for both the in charge, members of staff, patient and patient relative. But when the in charge, members of staff are in different domain, wannan yayi kudu, wannan sun yi arewa, then at the end of the day, the patient outcome empowers staff to take ownership of their working environment, encourage them to make decisions politely, correct them when mistakes are made, and show them the right approach. Avoid scolding your staff in front of the client and patient relatives. It was so unfortunate. The same thing in regard to this point, even though it's not, you can't call them, there was an issue that happens. It was pay modeling. Now, issue of role modeling is you want to be copied. can be their role model. Please, for the leaders here, and I don't mean the in charges only, even you as the shift in charge, there is no way you can come to duty by 8:30 a.m. and expect your staff. In Hausa, they said, the Ghana government is getting to work. So, if you are a leader, you should lead by example. But if you are the type, say a hankali, you have the same issue. Now, staff development. Support staff development through training, mentorship, feedback, and helping them grow professionally. Maybe today, Garba Umar that is in charge of here. It happens, Suleiman is under him. This is so important. You can guide him. You shouldn't be type of people that will be testing, but guide him. What is the challenge? Let's discuss. How can we iron out the challenge? One day, whether you like it or not, you must definitely leave that place. Don't forget that that office you are in is somebody that moved out of the office. So you step into the office. So as such, get ready. One day you will vacate the office and somebody that will come. So it's better for you to prepare the person. Guide him. It's not based on interest. It's the person of him. It's dedicated somebody. Then here, there is the need for collaboration among interdisciplinary teams. As a leader, promote the culture of teamwork and mutual respect. This is very, very important. If we look at it, the hospital setting is full of different cadres. But what's the issue? Money must wait. Then a role must be there. Enabling environment should now be created not only to your staff, to other team members. In this point, I'll also give an example to one scenario. It was also a nasty scenario that happened. It was during ward round. Initially, in ward round, we identify problems and how best to develop solutions. Promoting a culture of continuous improvement. The staff working in the department or even though I'm not a Hausa somebody, he passed through the same training, even if today he is the DNS, highest rank agent, or maybe he is the registrar council. He needs intro, post-intro, and other things. Then those that are under you, guide them. You shouldn't be always the one to do it. No, it's too bad. And it's engaging this. At the end of the day, it's producing what we call flow effect in leadership. When you are not there, chicken, team collapses. So we should have multiple of your kind so that they will help to resolve the problem in the world. Next slide. If you are talking of leadership, I don't know, it's at a critical crossroad, particularly in Nigeria, where the aging process has taken a toll on the number of those retiring and the get-rich syndrome of the younger generation. Therefore, if the image of the profession is to be safeguarded, there is the urgent need to prioritize leadership development or mentoring so as to prepare the younger ones for leadership roles, which will soon be their responsibility. As such, the older nurses that will soon phase out need to be concerned and proactive to address the challenge. Get-rich syndrome was nasty scenario. You are now mentorship. Mentee. If I'm not in charge of the work, so how will I be mentored to somebody? This is absolutely wrong. She in charge in Haifans Aka is in charge? No. One day you'll be in charge. If life continues, even the unborn have likelihood tendency to be in charge. Formal leadership development programs can provide future nurses with the skills and knowledge needed to succeed. This is issue of policy making. In some places, don't forget, every year there is a leadership workshop organized by Nursing and Midwifery Council. The main target of those is to have impact on their mark, to help leaders to have more skills so that they will lead successful. Next slide. Networking. Encourage nurse leaders to network with peers and other healthcare professionals can help them stay current and share best practices. Maybe Salisu is the intern or any team. If they come for ward round, they will come. Maybe it's the day of ward round. But you, as the leader of that specific ward, you can't contribute anything or you can't give direction to anything. Or maybe they come, they want so patient on so bed to have an update information in regard to this current status. You can't do that. Then automatically you are not networking. This patient is to go for urgent PCV and grouping. Maybe by doing that PCV and grouping, the patient will be taken to the surgeon immediately. But the patient relative, or maybe we have language barriers. For us to look for third party to interpret the other mic, then you automatically drain the procedure that is going to be carried out to that patient, and you are not networking. Just simple for you are take your phone and direct it to Jewry Kaza Kaza. One patient Kaza. It's not your patient. But don't forget, you are an advocate. If you are an advocate for somebody, then it means you can stand for him. Healthcare organizations can improve patient outcomes. I'll charge you. Staff satisfaction and overall quality of care. This staff satisfaction, at least as a matron in charge or as a person in charge of the unit, if you create the enabling environment for the staff to work. Now, the simplest enabling environment is maybe, let's assume the gadget we are using. I will just give simplest example, the stethoscope. Maybe it is only stethoscope. The only stethoscope you are using, the earpiece is no longer there. But a hacker, staff also can managing. But it is your responsibility. Take it to the maintenance. Let them require it. Repair it. Once it is repaired and tika kawo, kin create mususu su ji dadin aikin su yi aikin. Not necessarily you are the one to do the work, but please, you are the one to cheer those to do the work. Leadership in the words, the benefit. Enhance patient care. Nurse leaders prioritize patient-centered care by ensuring that patients receive high quality and compassionate care. Improve communication. Effective communication among healthcare teams, patients, and families is critical for delivering high quality care. I'm a nurse. This is doctor. This is lab scientist. This is social worker. This is whatsoever. Now, if we now agree to come together, who is at the middle is the patient that is at the middle. But when the team, everyone is going towards different direction. At the end of the day, this delivery of high quality care will not be achieved. In Hausa, there is what we said, taure zai je barbara kuma zai dawo da ciki. Shi da yazo bai da lafiya, maimakon ya samu magani. Sai condition ya ci gaba da staff satisfaction. In regard to this adage, it was somehow so nasty. If it happens in a unit you are the type that wants to work and you are in the midst of those wana magandata, you have a lot of names. A lot of names. One is Shida Mayafi. Staff satisfaction with leadership style in their working environment greatly increase staff commitment and dedication. Nurse leaders who prioritize staff well-being and development can improve job satisfaction and reduce burnout. The staff is battling from pressure from the patient relative, pressure from the patient himself, pressure from the co-workers who are outside the profession. Then you as the leader of the shift, leader of the ward, you are the one to provide a soft landing. But so unfortunate, a good nurse leader bring a unique perspective to decision making, ensuring that care is informed by evidence-based and based practices. If there is an update in regard to ways of doing other things, as a matron in charge, if your subordinate provide basis for, yanzu fa kaza kaza nan kaza ake kaza kaza nan ya canja. Don't say that but test run it. Test run it. To gaskiya ni ban sani ba, lokacin mu ba kaza kaza bane, amma tunda kun ce haka, let's see it. You have created an enabling environment. Staff recognition and developments can improve job satisfaction and reduce turnover. Next slide. I'm talking about leadership. Now, let's take leadership of the alphabets. What does it mean? Now, L, loyalty, standing by your team and by mission. How can you stand by your team? Guide them, let them do the needful. And when they do it, stand by it. If there is an issue, go back home and lick your own, by not in a public. Call him or her into the office. Sit down with him or her, then make necessary corrections. Understanding and considering others' feelings. This is an issue, please. If a D, discipline, staying focused, consistent, and committed as well. E, empowerment, helping others to grow and succeed. We have been saying a lot of things before. Please, contribution, treating everyone with dignity and fairness. Please. We putting the needs of the team or community first. You are in charge of the truthful and transparent in all our dealings. Sometimes in the ward, you see a patient, but he or she has her own problem or his problem, but he is not going to disclose it to anybody. Say one ko. Now, why? Because he trusts him or her. Even if the team is there for the ward round, he or she will not speak it, will not talk till say kinzo or say kazo. Doing what is right, even when no one is watching. Yau zan yi mai kyau ne saboda in charge tana nan. Parents, staying determined through challenges. Please, issue of challenges as leaders. Whether we like it or not, we can't do without challenges. It's better the challenges should be tackled. Some challenges, if we now has a crucial role to play for quality healthcare delivery, it is equally very important to note that every profession within the healthcare team have their distinct professional limitations. However, there is the need to collectively work together for the benefit of the patients. As the matron in charge, ward round is carrying out, but I'm just sitting in the office. And kuma, I expect things to go well. I don't know whether if it is from the sky. So it is our role. Okay. Nurses and midwives play a vital role in ward rounds, which are essential part of the patient care. Unfortunately, gradually, nurses in the ward had stopped or ignored this important aspect of the care. When you come in the morning, you said good morning to a patient while taking over, and the patient has been seeing you all day alone. Then at the end of the day, he now lay a complaint to you. And don't forget that some of the patients are villagers like me. This is the first time he's coming to Damaturu. So if you now see a lot of people going together with this lab coat, it's another area of issue. So, but when he see you alone, he was able to lay down, stated the complaints. Nifa kaza yayi kaza baya yin kaza. Wonder initially he was unable to lay the complaint to the team. So now it is you he trusted and shared the information. It is expected you message. That some of us might be tempted to ask about or consider that the doctor's ward round, is it enough? This is the perception I also regard as swinging around also to do before the ward round. Review patient charts. When you are taking over, it was so unfortunate to the extent that insert information, collect relevant data such as vital sign, laboratory results, medication list. Please, laboratory results. Explain the purpose of the round and established a rapport with the patient and family. How can you establish rapport with the patient and patient relative when you are the type that even good morning remains a big deal? In outside the session, assess the patient's condition, including physical, emotional, and psychological needs. Next slide. Collaboration with interdisciplinary team. Work with other healthcare professionals to develop and implement care plans. Please educate patients and families about their condition, treatment, and self-care. One scenario, effective communication, clearly communicate with patients, families, and healthcare team members. Critical thinking, analyze patient data, identify concerns, and develop appropriate care plans. It is so unfortunate for patient needs and manage time effectively during the round. Please. Emotional intelligence. Demonstrate empathy, compassion, and understanding when interacting with patients and families. Please, we shouldn't forget empathy and sympathy. They are two different things. They are entirely two different things. When you sympathize, then you cause damage to the patient. I give example to just, I think, last informed and supported and involved in their care. This is very important because if the patient relative know exactly what is happening, they will help you and they will help their patient and they will help the entire team in managing the patient. For example, now a diabetic patient, the patient relative were not informed. They'll carry everything and give him. It is you that know that exactly that everything is going to cost his life. Or somebody that is having intestinal obstruction or bowel perforation, and he or she is to go for surgery, he was asked to be on NPO. Kawai kinzo ko kazo karki sharuwa. A harsh way. The next thing for the patient and the relative who said, it is you that knows that action will contribute to his termination of his life. Shi bai sani ba. In a layman term, he will effectively contribute to increase efficiency. Okay, benefits of effective ward round: improve patient outcomes, enhance patient satisfaction, increase efficiency. Evaluation of patient physical, psychological, and emotional needs. Note the role of the nurses during doctor's ward round. The nurses has a significant role to play during the doctor's ward round because, as earlier mentioned, the nurses stay with the patient 24 hours, and the ward round that they conduct provide them informations that the doctors cannot extract from the patient during the ward round. The nurse of the patient need to be very alert to provide adequate informations that they need, that they have been able to extract from each patient during the nurse's ward round, and which the patients, out of anxiety when asked by the doctors about their current conditions during ward round, patients might have revealed to the nurses during the nurse's ward round about how they feel after taking certain drugs, etc. The nurses can inform the doctor about such complaints from the patient during the doctor's ward round.